to this slide. So we do want to welcome you to the program. This is an informational session, so we are going to talk about the application process, like I mentioned, but we are also going to talk about the actual program requirements. So these are the things that you will need to be doing in order to meet the eligibility for the application. So that's the application itself telling us who you are, and then there's some requirements that need to be done on top of that. And all of those need to be completed to be considered an eligible applicant to enroll in those classes in the fall. So the purpose is to assist you with the information and the requirements. We will go through those individually. We will explain what they are, show you what the application is, and then just answer your questions as we go. So the Nurse Assistant Training Program, it's the Medical Science B69 course in the schedule. It is a 6-unit course. So in one semester, you complete the program. At the end, you take an exam, and you can then get your certification as a nurse assistant. It has a lecture portion and clinical instruction. So the clinical, you will be placed at a facility, and you'll have a 12-hour day at a clinical facility. So just to be clear, on the class and clinical locations, it's saying Bakersfield, McFarland, Wasco, or Delano. So maybe you have your placement for your class in Bakersfield. You may be placed in McFarland if that's where we have space to place you. So just keep that in mind. Make sure you do have transportation, or you're able to carpool with another colleague that may be going to the same site as you. So we do want to make sure there's nothing stopping you from participating fully. If you cannot attend clinical, that's going to be a factor in you being successful in the program. Did you want to add something, Diane?
No, that's
okay. So the application itself. So I did update the website. There's more updates to the website coming. I don't know if you're familiar with the VN page, but there's some little tabs like the application process, the selection process, eligibility. We're going to have a similar format in the nurse assistant page. So just keep your eyes out for that. It was just recently submitted, so maybe give it a couple of weeks. But for this upcoming fall, the application period is June 15th to July 15th, so it's 1 month. And the reason we have those dates is because of some of the requirements having due dates that are closer to when school begins. So that's a strategic dates that we're selecting. The same for going into the January classes, spring semester, we have a window of November 15th to December 15th. So let me just pull up the actual application for you. Okay. Everybody see that?
Yes.
Okay. So this is what the application will look like, very similar to our other programs like the vocational nursing and our registered nursing. At the top, you're probably all going to be new applicants. If we are at a point where you have applied a couple of times, like let's say next spring, you're going to say prior applicant and when did you apply. We do list the locations, like I mentioned, Bakersfield, McFarland, and Wasco. If you only want Bakersfield, pick Bakersfield. If you're open to any of them, pick all of them, but put them in the sequence of priority. So McFarland's number 1, then Bakersfield, then Wasco, do your 1, 2, and 3. Okay. We also have certified home health aide as an option. This is something we just added this semester for the first time. It's a 3-week course, and then you'll have an additional certification on top of your CNA, which is a really great thing for a lot of our students. So you'll notice in the schedule, they're purposely 13-week classes. So you are able to enroll in the home health aide in the same semester if that is something you're interested. And I'll quickly have Diane just kind of touch on what a home health aide is.
Sure. So it's a little bit different. Hi, everyone. I'm Diane Jenkins. I'm so glad you guys are all here. So the difference between a certified nurse assistant and a home health aide is the certified nurse assistant can work usually in a facility, whether it be a long-term care facility, a hospital, a surgery center, wherever you desire as a certified nurse assistant. The home health aide is particularly taking care of residents or patients or clients at their home setting. And also that requirement is also for some of our hospice settings.
Thank you, Diane.
You're welcome.
So on the rest of the application, it's basic information about yourself. There is one question: have you ever enrolled in a nurse assistant training program? So that can be yes. I know some students reach out when their CNA has expired and maybe it's been over 2 years, so you actually have to retake the class. Those are the kinds of things we'd like to know. So if you could fill that out with that information, that'd be great. Any schools you've attended. The second page is just demographic information. This is, we need to track a lot of the type of students that we're seeing and assisting and seeing if we can be strategic in our outreach. So please complete this. And then that third page will be an authorization to release information form. This is something all program students in the allied health nursing programs need to complete. So you want to take a look at this, read through it, agree or do not agree, and then sign and date. And then I believe we have to have one where you agree in order for you to take part in our program. So on that last page though is the actual application checklist. So at the top, it's saying required to apply. So in addition to that, the first 2 pages and that authorization release, this is telling you what else you need to submit. We just need copies, not the originals, okay? So proof of immunization, and we will go into this in a little bit more detail, so I'm just gonna read through them. MMR, which is measles, mumps, rubella, varicella. These are a lot of things that you did as kids. So it's not something yet you probably remember. The COVID-19 vaccination and the booster. Your flu shot. For this upcoming semester, we already know that you cannot get a flu shot for the fall until after August 1st. So in this case, if you're applying for the fall classes during that June to July, this is the only one that will have an exception for this fall semester, okay? But going into spring, you should already have it. The CPR, basic life support, we need that card. And we can fulfill that if you have not done that by taking the Meds B52 class. I'll have Gio or Abraham drop a link into the chat box showing you what summer options. There's something every week in summer that you can take. It's a 1-day class and you're done right after the class. A physical exam must be completed within 60 days. So the physical and the TB test, that's the reasoning for that June 15th to July 15th, because that will fulfill that 60-day window before you actually attend clinical. So at the bottom, these are requirements once we actually offer you a seat. So once you, the deadline has passed, whoever has completed an eligible application has all the requirements that are listed above that I just read, then you're notified more than likely by Robin or someone in the office to your BC email, letting you know what next steps are. And they will provide you with dates for the drug screen, your background, and your live scan. Okay, and then like I said, Diane will go into a little bit more detail on the rest of these requirements. This application will not be on the website until that June 15th to July 15th application period. We're good? Okay. I'll go ahead and have Diane go over the healthcare requirements.
Okay, so I'm just gonna, hi everyone again. So I'm gonna cover the healthcare requirements. So like Vanessa said, with our healthcare requirements, the reason why we need all these healthcare requirements is to keep you as the students safe, but not only you, but to keep all the residents safe to the facilities that we will be going to. So again, just to kind of highlight what Vanessa said, in regards to the healthcare requirements, when you submit your application, all the requirements have to be completed in order to have your application accepted. We will not receive or accept any in-progress immunization requirements. And if you fail to meet the requirements, then again, it will be an incomplete application. So what is required? So Vanessa kind of already named them off. If you could go to the next slide, I will go ahead and highlight them. So the first requirement is the COVID-19. like Vanessa said, we are requiring the 2 doses of the COVID-19 and also the booster. So I'm just going to kind of highlight this slide because it's so important. So we, as Bakersfield College, the Nurse Assistant Training Program students, are guests in our clinical settings and facilities. Our community partners welcome us into the facilities and rely on us to adhere to the most stringent professional and safety standards. So in regards to this, some of our clinical facilities require both vaccines and the booster. There's no exceptions that are being offered at this time. So if you choose not to get vaccinated, you will not actually meet the clinical course requirements. And that clinical portion of this class is a requirement to pass the course. So with Meds B69, there is a theory component and then a clinical component. And you guys will love it. It will be life-changing. All I can say, this course is life-changing. So we'll keep going with the healthcare requirements. Also that is required is MMR and the varicella. So MMR, what is required are 2 doses of the vaccine or a blood test. So most of you have had 2 doses of the MMR when you were a child. If you have proof on your shot record, you may submit a copy of your shot record, but please make sure your name is showing on that shot record, and then that would cover this requirement. If you do not have the 2 doses of the MMR vaccine, then you would need both doses from your healthcare provider. But if you have received them as a child, but no longer have a shot record, then the best option would be to go have a blood test. And what a blood test would require is they'll draw blood and they will test to see if you have positive titers for measles, mumps, and rubella. Excuse me. But what that means, I'm just going to break it down so you guys understand. So they're going to draw your blood and they're going to check to make sure your blood has what we call antibodies that are positive for measles, mumps, and rubella. So why do we need that? So if you were ever exposed to measles, mumps, and rubella, and you have positive titers that will fight that off, then hopefully if you are exposed, that you will not catch the measles, mumps, and rubella. The second requirement on this slide is also the varicella, also known as the chickenpox virus. And the same requirement is needed for that. We need 2 doses of the varicella vaccine or also a blood test, the blood titer test for a positive varicella titer. Next is the hepatitis B, which the requirement is one of the following. So again, I keep saying you probably had this as a child because many of you probably did have this as a child. But what the requirement is, 3 doses of the hepatitis B vaccine or 2 doses of the hepatitis B vaccine. So both the 3 doses, and the 2 doses of the hepatitis B vaccine is a newer version. And that hepatitis B vaccine has to be at least 4 weeks apart. So you'll receive 1 shot, 4 weeks later, you'll receive the 2nd dose of the hepatitis. If you have already received it or you cannot find that shot record, then again, you can have a blood test. They will draw a hepatitis B titer, and it has to come back positive for antibodies. The next requirement on this slide is the Tdap or a tetanus shot, and you have to have had a tetanus shot within the last 10 years. Influenza is next. The influenza is your flu shot. So a flu shot is required for that current season. So again, for the summer cohort, that for the fall 2023, you do not have to have this influenza requirement done because you cannot get the next season's dose until after August 1st, 2023. TB test is also, this one is the 60-day. This requirement of a TB test has to be done before 60 days. So you cannot even have this done until that June 15th date. So you can print out your application, you can have all the other requirements I talked about, and then on June 15th, go and get your TB test. So there are different requirements. You can either have a 2-step TB skin test. What does that look like? So it's different than a 1-step. So most of you probably have had a TB skin test where they injected the PPD into your skin. You went back to the place where you received the skin test, anywhere between 48 to 72 hours, and you were done. But with a 2-step PPD test, it's a little bit more, it's actually 2 complete tests. So you would go and have your TB skin test. You'll go back to that facility within the next 48 to 72 hours. They will read it. If it comes back negative, then you will have a second TB skin day test, that is exactly 21 days apart from when you first had your first TB skin test. And then after that second dose, you will go back to your facility and within 48 to 72 hours to have that TB skin test read. The second option is just to have a blood test. I'm all about these blood tests because I feel for time, I'm always trying to save time, but there is another test for TB. It's called the quantiferon or the T-spot blood test. There again, they'll draw your blood, and this time we want a negative reading. If you're negative, you will submit that in with your application. Remember, we don't want any originals. We just want copies with all the submissions. And then some of you may have already had a TB skin test, and for whatever reason, you tested positive for TB exposure. If that is the case, then you will submit a negative chest x-ray and complete the TB questionnaire. And that again cannot be completed no more than 60 days before the program start date. I know it's a lot of information, so we will have a question and answer session as soon as we're done with the presentation. This is for your physical exam. Now, this is the only part of this whole application where they're gonna, Gio, would you put the link in where they could obtain this physical exam form? This is the only requirement that you need the actual BC physical exam form. Everything else can be from a lab, it can be from your doctor's office, but except for this physical exam form. The physical exam form, again, has to be completed no more than 60 days. There are 3 pages to this exam form, as you can see, that's on this slide. The first page to the left, if you could point to it, Vanessa. Okay, that first page, that is page 1. That is to be completed by you as a student. The second page, which is in the middle, also will need to be completed by you as a student. And then the third page, thank you for the pointer. The third page is either going to be completed by your doctor, and you'll take that to your primary care doctor or healthcare provider. The next slide is I also want to let you know that BC, a shout out to them. We love BC. Actually, we're so blessed to be here. But with BC, our Student Health and Wellness Center, they offer these free of any charge. So as long as you are a registered student and you have no fees due, they will do this physical exam free. So I would really highlight that to you guys because I am thrifty as well. So if you choose to get your physical exam, then you still have to print out the BC physical forms that Vanessa's pointing to. You will complete pages 1 and 2 of that physical form that I just spoke of. And then you will also submit your paperwork that you receive after you have your physical from the Student Health and Wellness Center. And it looks like the first 2 pages on this slide. Next, I'm going to say a little bit about the CPR. Really, really important. I know Vanessa said about that Meds B52. It's an awesome course here at BC, but if you need to go to a different provider for any reason, it must be an American Heart Association CPR course for basic life support for healthcare providers. So it's just not a basic CPR. It has to be for that basic life support for healthcare providers. And it must again be American Heart Association. We will not accept anything that states curriculum based on AHA, which is American Heart Association. Once you then at this point, you submit your application and woo, that is a big process done. But then once you are selected to be in our fall cohorts, and we have enough seats, I believe, for up to 130 students. So there's a lot of seats open for you guys because we already believe in you guys. You guys will change the world. And so, but the requirements, once you are selected, we will send out an email. The office will send out an email, and then they'll give you information regarding a drug screen, a background check, an immunization tracker. These are the prices because we like to tell you ahead of time so that you're prepared. The live scan we will do once you guys are actually the first week of school. That first Saturday of the first week of school, we will have it at the BC campus, and our college will pay for that. Regarding the drug screen and background check and the live scan, so as a condition of enrollment into this nurse assistant program, all of the nurse assistant students are required to submit and pass a drug alcohol screen, a background check, and a live scan. So again, we will send instructions regarding all of these once selected into the program. Immunization tracker, this was also part of that cost list. Our immunization tracker is called American Data Bank or Complio. And what it does, it houses all your immunization records to ensure compliance with our clinical sites. Once again, when you're selected, we'll tell you more about American Data Bank, but it's awesome to have a tracker. And we'll be able to explain more about that as the program goes on. Uniforms. So again, once selected, we have specific uniforms that we wear to the clinical facilities for our clinical portion. They are the Wonderwork brand red scrub top, and it must have the Bakersfield College logo that will say Bakersfield College nurse assistant student. That will be the shirt, and the bottom will be black scrub pants. You will also need all white or all black leather enclosed toe shoes. And once you are selected, we will give you a whole list of vendors, but primarily now we only have 2 vendors for our red scrub top, but we'll give you more information about a later date. Also, what is really exciting is we have a uniform loan program. It's a first come, first serve, based on availability, but we will have a day that we will have everybody come to campus, first come, first serve, and we will be able to loan you out a uniform for the semester. And then at the end of the semester, you will return it back to us. And so we just really value this uniform loan program in any way we can help with the cost. Also, too, I'm going to just probably say about our textbook, too. We also have a textbook loaner for fall 2023 as well. Now I'm going to let you take over with the projected cost, Vanessa, but thank you all. I'll be available for questions.
Thank you, Diane. So this is just a snap of the projected cost sheet. So depending on if you have financial aid or you don't need a parking permit, of course, this final number will change. She did mention the book. Even though the cost of the book is there is the library loan program. So that's going to be where we issue you a book. When you're done with the class, we won't give you like your test date or anything until you return the book. So that's how we make sure that we can continue to offer free books to our students in the upcoming cohort. The prices, I believe they're all what she went over already. So there's really nothing more to go over there. Abraham or Gio, one of them will drop the link for the cost sheet in the chat box for you guys. And if you have questions, of course, ask in the chat box. And on this page, just make sure you are applying for financial aid. It is a covered program with financial aid, so this isn't something that you have to pay for that whole $1,400 that you see. There are scholarships available. The scholarships for the upcoming school year, that deadline has already passed. But if you're going to continue your education in healthcare after your CNA class, absolutely apply for scholarships, because that will take you into your VN program, the RN program, or even if you transfer, right, to Cal State Bakersfield, there's transfer scholarships. So that usually comes out in October. CalFresh information is listed on here too. We have many resources through Student Life, so absolutely take advantage of that. The student pantry, I don't know if any of you went to the little farmers market thing they did the other day. That's a great thing that they offer students, and they continue to do that all the time. So we want to make sure there's no speed bumps or struggles while you're completing these requirements, okay? So I believe that's it. Anything else to add, guys?
Yes, I'll just add, that's why we had this meeting, just to make this a smooth process for each and every one of you. We're just really, really excited for fall 2023 and to have you.
Yeah, and like I mentioned right at the beginning, this is our first time offering the application process. So at this point, if you're selected, you get a seat. If let's say 300 people want only Bakersfield, at that point we'd have to do like a lottery selection to seat people. So there isn't a wait list at this time. So that's not anything that we've established. So and of course, if there's any hiccups or things we need to fix, we'll just fix that as we go. So we do appreciate your patience with us with this, but we really feel that this will be an easier way for you to start this class. So if we